Well, I'm presenting from Bad Segeberg, quite located in the northern part of Germany. Um, this is my team. I'm working as an obstetrician and gynecologist, just in generally dealing with oncology, um, urogynecology, and prenatal diagnostics. We do deal a lot with beauty and science in the same time, and since 10 years we're working with lasers, um, fillers, Botox, and other things in the beauty industry. Um, we are working with lasers in the face and in the whole body since 10 years already. The learning objectives of this webinar will be if there's an alternative device for standard therapies in gynecology, which system to choose to do so, what are the therapeutic indications for CO2 laser systems, how they work. Um, we'll look into some actual studies, and we'll talk a bit about these technologies and if we can deny them because we are all settled. So if you look in the technology advances, they are much faster than we think. If we go through a 2012 study of the emerging future, within the next 6 years you have a 32-fold increase of technology, which is approximately the time that we do investments usually in machines. But if you go further and look what will be there in 10 years, it's a 1,000-fold increase in the technology advancement. And if we look through 20 years, which is a normal working time for an obstetrician and gynecologist, the amount of advancement is just incredible. So it's not like a linear progression in this time, but it's much more. So the question is, do we need new therapeutic options? And if we look at some standard therapies regarding vulvovaginal atrophy, we do have topical creams, ovular estrogens, phytotherapy that we can use. We have the same for perimenopausal symptoms. And if we regard vaginal laxity, we use physiotherapy, Kegel exercise. We can use the topical creams as before, and we can do it surgical. So is there something that we can do better? And of course, yes, we can do. Studies that we already know since 2013 shows that almost 2/3 of our patients are not compliant and do not like to use these formulations. They give up and give in their faith of having these complaints later on. So again, we start seeing that even oncologists, which are very conservative, start to favor CO2 and erbium lasers for the treatment of vulvovaginal atrophy, especially if you regard oncology patients. So they're not really very convinced, but they're starting to get into it as there are few studies. So in the end, what should we use right now? Which laser should we buy, and which system should be suitable for our clinic? And there is a broad range of machines. Once you enter to exhibitions, you're confronted with erbium laser, YAG lasers, DC or RF CO2 lasers, plasma pens, rollers, radio frequency, and even some other machines. So if we think about it and we want to integrate a machine that has a highly financial potential, we should have a distinctive choice for obstetrics and gynecology. Plasma pens, rollers, radio frequency, they don't offer a surgical options. So we limit ourselves to something that we might really need after having that investment. So we will be talking about lasers in the further conversation. If you compare these different energy-based technologies today, you will see that RF-excited, DC-excited erbium YAG lasers and radio frequency-based devices have a difference. And if you don't want to minimize the impact on your daily routine, you have to think closely that in the end, you want to have a device that does ablation without any bleeding, that can treat pigment and has a surgical handpiece so that you can work with it. I don't want to get too deep into this. All these lasers have a specific target, so they're working with something that you um, call target, like water or the um, hemoglobin. And the CO2 laser usually has a wavelength that has a short absorption depth in water-rich soft tissue. It offers precise cutting and ablation of this tissue and has a sufficient hemostasis, especially if you want to go operating. This should be mentioned. It depends on your setting, what you want to do. So once you start buying a machine that has a low potential in ablation and a low potential in coagulation, you of course can switch. But it will be very soon happening that you, apart from being ablative, you want to be operative, and this will finally lead you to going on with the CO2 laser that is most likely radio frequency based. These lasers are targeted. They ablate a defined layer of skin. The energy defines the depth, so once you choose a low energy, you will not have a very deep impact onto the skin. You can have it fully ablative or fractionated. It causes a collagen contraction at a target temperature that has to be above 61 degrees centigrade. It has a coagulation, so you have very bloodless therapy. And this is the one thing that is induced by CO2 lasers with radio frequency. They go deep into the skin and cause a neocollagenesis with a defined hyperthermia in the tissue. Even furthermore, we will see that it also will cause some other effects on the extracellular matrix proteins as well as on the elastin fibers. And if you combine it with a superpulse, you will have a minimal collateral damage onto the skin, which will help the patient to have less pain and more effect. The laser tissue interaction caused by a laser beam causes carbonization with a high temperature in the center of the lesion, which is furthermore done by vaporization before. You have a coagulation zone, which is in the middle, and you have the therapeutic zone with a hyperthermia at around 38 to 65 degrees Celsius in the bottom part of the laser beam. So what happens is you have a biostimulation, which will cause neocollagenesis. You have a coagulation of the by breaking the chemical bonds, protein denaturation, and you have metabolic effects as well, which will cause the tightening. And of course, you do have an ablation or evaporation depending on the temperature that you use, and you will by this cause certain channels that will help the skin to heal. So furthermore, we need a special pulse that causes the effect. So what we don't want is excessive heat. We want a very accurate pulse and with a very defined area of action that we can use as being a fine surgeon. The regenerative model that underlies this is that you have a defect in the epidermis, you make a microscopic laser puncture, cut out this channel, you have untreated zones to the edges of this laser puncture. This will induce new cell regeneration of the untreated zones, and later on you will have no more defect and in your skin. To achieve this, you have to be careful if you use, for example, continuous wave mode CO2 lasers, because you have these areas of overlapping where cumulative heat will appear and you will have a damage and not the effect that you want. It will cause pain and other unpredictable side effects. It's better to have a very fine and sharp needle-like laser beam, which gives you predictable tissue damage with a defined and reproducible damage, and cause collagen retraction, neovascularization, elastin, and collagen induction. We have several studies about that. So now we're going back from technology to patient and ask ourselves, do patients ask for it? Do they need this? And of course, they do get a lot of information through social media. They talk to each other much differently than they do with us. And for this, there was a large survey done in 2017, and women were asked, lots of women were asked what they think might be influencing their health and their wellness, and how they can best live and achieve the highest level of their wellness. What comes out in this study, which is very long, is that the top 5 women's wellness definers were stress, sleep, exercise, eating and being healthy, and of course anxiety. And the top 5 fears in order were cancer, bad debt, living in pain on number 3, no health insurance. This is an American survey, so they are concerned about that, and mental illness. What helps this for us? We were talking about sex, and people were asked, did you have had satisfying sex within the last days, weeks, or month, or never? And if you look at the numbers, you see that almost a fifth had never had satisfying sex, which may be due to some physiological facts that come along with aging. Is good sex important? Yes, of course it is. In almost 26 to 22 or 17% respectively, it was important to the patient. So are they worried about their body then? And of course they are. If you look at it, a higher number of patients and people that were asked worry about their appearance, which we are treating. They are worried about their love life and about their reproductive health if you regard the intimate area as part of being that. Um, a nice question was, is sex better craved among amazing food? And of course it was. People would like to have more sex and less better food. Um, so if we talk about the physiological changes and dysfunctions, um, these issues are related to physical changes or conditions that impact intimacy. They have pain during sex that causes distress or strained intimate relationship. They're not wanting to have sex, not having an orgasm during sex, or not even becoming aroused. There are lots of cases for it that we don't want to get through, but these are the effects that they take. Um, you have vaginal atrophy, dryness, and laxity, which we can treat with CO2 lasers. You have vaginism, and that can have possible also psychological as physiological causes. And of course, we need to talk about urinary incontinence or leakage as well. Pain is something that is commonly presented within our daily office, and we need to talk about this vulvodynia, which is a very misdiagnosed diagnosis, painful intercourse, which is called dyspareunia, lichen sclerosis, which is often overseen and starting to get more and more into the focus, vaginal burning as a symptom by itself that can be found in the other diagnosis as well, and of course pain after trauma to the pelvis, which is not too, hopefully not too much, but childbirth as being one of the traumas is very important in our daily routine. Non-coital sexual pain can, of course, occur without having sex. We have lots of treatment options that we are all aware of that more or less are not satisfying for us, as people try or are coming back frequently to ask for more advice and further action. And these lasers now offer us a new spectrum of therapy that helps us to help these patients. So what are the personal prerequisites for a reproducible scientific approved therapy for me. Um, of course, you need to have a sufficient therapeutic depth so that you can have the extracellular matrix changed. We need a vaporization of debris to get rid of unwanted heat, so you do have to have a superposed laser. We need to have coagulation to work bloodless, especially then if you're going further and have more therapies that are beyond just vaginal therapies. Defined area with target temperature, so you want to have a reproducible result. And of course, you want to have a minimal amount of excessive thermal energy as the patient doesn't have pain and is more likely to come back. Only like this you will generate a reproducible result shot by shot and treatment by treatment. So what are the advantages for your patients if you use a laser that has a digital superpulse? It has a reduction of epidermal necrosis with less pain, advanced result, and no anesthetics needed, almost. And how do we achieve this? It's gone through a generated radio frequency module that causes the laser beam extremely fast, other than a DC generated laser beam. The excessive heat is reduced to a minimum. So what you can see, this is an ordinary picture of a classic ablative CO2 laser treatment, how it was done before. Of course, there's some cream on the face. And on the right side, you see a modern CO2 laser on day 2 after the treatment, and what might look quite disgusting to you is something that will be resolving, especially to the right side, after day 4, and the patient will be quite happy. So if you see that this effect can happen to a face, you can now see that we also can skip over to the intimate area, and with the ability to treat women's intimate area with a modern radio frequency devices laser, this is a major stepstone in the therapy of various gynecological conditions. We have a lot of possibilities with a CO2RE Intima lasers that can be used from a very, very superficial profound treatment to a very deep one, or even combined deep and overlapping therapies. It's very easy to learn and very easy to use. Usually you need 5 to 10 treatments and then you're in and you're already starting to advance to other therapies. The device is shown on the right is easy to handle. You can carry it around, and which is, for me, as I have 2 operation rooms, is very convenient. It has about 16 kilos, 16 to 18 depends. So there's an indication for every phase in the life of a woman to have a therapy with the CO2 lasers. And in an American survey that was done 2017, 63% of the asked women would like to have a non-surgical tightening of the vaginal canal. 75, so almost 2/3, or no, 3/4 of patients suffer from peri and postmenopausal syndromes like vaginal dryness, burning, itching, skin laxity, and loss of sexual lubrication. 90% feel that it's a loss in their everyday quality of life. 60% suffer from a stress urinary incontinence within their life, 29 already around the age of 40, and 23% after vaginal delivery. Of 250,000 new breast cancer diagnoses in the US 2017, almost 90% suffer from extreme vaginal dryness, which caused the AGO to have new guidelines which take up lasers as well. In our daily routine, we see condylomata, vulvodynia, atrophies, vaginism, stress urinary incontinence, and other diagnoses as well. And they all have a place for a laser already. You can easily treat condylomata acuminata. These are perianal ones with the laser. And to our very surprise, these ablations with a laser almost are painless afterwards. You can treat vulvodynia as well. This is underdiagnosed and part of another webinar probably that we can talk about the treatment. You have different settings, and you have different definitions, but it's a chronic disease, and people are really, really running from one physician to the next to get their pain relieved, and it's a multidisciplinary approach today, which can be supported by laser therapy very well. So we had a small number of patients that underwent a study, about 70. They had a microablative CO2 laser treatment for vestibular pain and vestibulodynia, and the treatment was very easy. If you can see the picture on the left side, they didn't need any they get local anesthesia as a topic cream, and almost 70% of the patients stated a significant improvement from the laser procedure. So if you deal a lot with these patients, you will find out that this is a very, very good result, as usually this is a very long-lasting disease. So if you want to treat the patient, you get along with a vaginal exam, you dry out the skin in the vagina, as the target of the laser is water. You make easy settings. They are preset in the laser system. You switch the system to ready. You enter the applicator into the vagina until you reach a firm but not too fast end, and then you pulse the laser once, and other, as it is stated here, you do a 360 degrees treatment, then you pull back 1 centimeter and repeat this. You have a 5% coverage of the area there, and stop until the whole vaginal area is treated. This is the end of the therapy then. If you look at the schematics here, you can see that what happens is that the whole tissue gets thicker, it gets an uplift into the bladder, and the vaginal canal is tightened. We then use the external rejuvenation in combination with it. We have 10 to 20 shots per side. You can have a local anesthetic topically about 20 minutes in advance of the therapy, which causes more satisfaction for the patient throughout the treatment. And if you look after the third set, right, you can see all these little white spots here that was well tolerated by the patients immediately after the treatment. This is a combined therapy of a 32-year-old patient has 2 children, hypertrophic labia, pain while intercourse because those labia tend to go in and out while intercourse, and she had a mild stress urinary incontinence. We did a labioplasty and 2 vaginal external and internal treatments, and now we have done already 3, and the patient is highly satisfied. She has no dripping anymore, and the sexuality has gained a lot. So she had a stress urinary incontinence, which about half of the patients, or today we see about 60% of the patients, will undergo within their history. So we had some very, very nice studies looking at this, although there are not too many patients enrolled. And the findings that Jaguszewska and al. Had with 161 patients was that after one treatment, after 3 treatments, they did a 12, 24, and 36-month follow-up. They didn't see any alterations in the treatment result if you regard the ICQ-UFSF scores. So this is quality of life questionnaire, and they did a PET test. So if you ask me as being urogynecologist, I don't like the PET test. So I prefer a study that was done by Falguni Patel with 20 women only, but she found out that the urinary urethral closure pressure increased significantly with a highly statistically significant p-value from 27 to 52.7 centimeter H2O post-treatment, which is a benefit to all of those patients. If you see this in the sorry for that. And if you see this in this graph, and the thing that convinced me is that there was no patient that didn't have any benefit from the treatment. So all of them had benefit. So if we take together the clinical study results, we have high satisfaction with these core 2 treatments. 92% are satisfied with the treatment which recommended. 73% of the subjects had an improvement in sexual gratification. 75% reported improvement in the rejuvenation, and almost all of them had no, or at least no, just a mild discomfort. 90% of the selected subjects had, with a mild SUI, reported an improvement after the therapy. So these lasers offer broad spectrum in the modern therapy in a gynecological practice, from surgical applications to aesthetic resurfacing and intimate restoration and rejuvenation. They're easy to use, portable, and they're in high demand by patients. It's getting more and more, even if you're outside Germany. They offer a lunchtime procedure. The patient will walk out and feel nothing. It's long-lasting result, at least 3 years. And most of the indications we don't know, but lots of them are already existing. So if we look at the newer studies with 43 postmenopausal women that underwent three CO2 laser treatments with the CO2RE Intima, and they assessed the vaginal health index at the baseline and after the treatment, they found out that the vaginal health improvement went from 5.5 to up to 10.5 12 months in the 12-month follow-up. So the improvement rate post-treatment afterwards did not decline after the treatment. We have histopathological examinations that find 5 months post-baseline increased collagen and elastin staining, and a thicker epithelium with increased number of cell layers and better degree of surface maturation. You can see these here as well, and again you can see more blood vessels that were forming and spreading into the tissue. The mean reduction from baseline could be seen here and was most for dryness, dysphoria, burning and itching, not as much from dysuria, which is almost clear. We do have other studies as well that are very interesting and show us that CO2 lasers, and especially CO2RE Intima laser, is effective and well tolerated by the patients. And of course, we do have the old, in brackets, the old treatment that CO2RE Intima lasers can turn back the clock. This is after one treatment with a CO2 laser in the face. So this is a very good example for what we do inside to be seen on the outside. So I do thank you a lot for your patience, and hope you do have lots of questions that I still can answer. I'm done with the main event right now and will be happy to answer your questions. Okay, as I can't see any questions right now, Sorry for that. Well,
There's a question
yes,
from saying, do you have information about the competition?
about the competitors. Yes. Um, Of course, there are lots of competitors, and what I tried to show you is once you choose your system wisely, you have to be taking into account that the technology is advancing very quick, and I wasn't focusing on things like plasma rollers or radio frequency devices, as to my personal opinion, these will limit your daily therapy just to vaginal restoration and regeneration, if so approved. Um, what I think is most important, that you have a device that helps you to get through the day with everyday routine. So we can do skin biopsies, we can cut out smaller condylomata acuminata, you can do operations, as I've shown you. I've done multiple labioplasties with a laser that show us a very, very good result, because what you fear most is not the operation itself. It is that you mostly have problems through wound healing afterwards. And since I use the laser, I don't see this anymore. You have a bloodless operation that helps you to have a good result almost a week or 10 days after the people have the wounds closed, and they're back to work after 2 weeks, and after 4 weeks you almost can see no scar. There's a question about anesthesia, and let me read. Yes, so if you ask the patients throughout the treatment about their perception, they will tell you that there's almost no pain inside the vaginal canal once you treat this, so there's no topical cream like Emla or something else needed. And of course, if you're treating outside, you will may have to use a topical cream to help the patients. Sometimes I just use a cooling device in before, like a gauze that's cooling, if you don't treat too much. If you have a larger area, for example, treating a lichen, which is quite large in the area, you may use Emla cream for it, but you have to really take it away afterwards because it's water-based and therefore may alter your result afterwards or cause some burning to the patient. I hope that will answer your question. The next question is, how many patients have all 3 treatments versus only 1? I usually do 3 to 5 treatments according to the patient's needs. It differs on the where you come from and where you want to go. Most of the patients report a good benefit after only 1 treatment, but to have a persistent treatment, usually we do 3. So if you look at my patients, all of them have 3 treatments. I do have a quality of life questionnaire that I give to the patients to establish the vaginal health index. And it's filled out before the treatment and after each treatment, so that we at least have a good database to see if the treatment improves. And what would be next is that we, especially treating the patients that have stress urinary incontinence, that we assess their urodynamic before and after the 3 treatments. There was a question, would you please explain, is the difference about pulses depending on the SIM type? Well, sorry for that. I have a wasp here flying around. So it's gone now. With this, of course, usually you mean the intimate area, and you have to be a bit conservative regarding the energy levels that you put up into very dark skin types, as you may cause depigmentation in that area. But usually if you use those small 5% deep mode, to me there has not been any problems occurring till now. But to be honest, we usually have patients with skin types 1 and 2 in the main. But if you ask other physicians that are using the laser, they don't have that problem. The average length of the treatment depends on your experience. So when you start to work with a laser, it takes you about, well, a good 10 minutes, not much more. Today, I must tell you that usually the internal treatment is done after 5 minutes because you get used to the settings. Everything is set up through your team, and the patients, especially if they come back for the 2nd or 3rd or furthermore treatments, they're used to it and tolerate it very well. So I would say an average treatment should be around 10 minutes internally and externally. Concerning side effects, I haven't found any till now. Most of the people that you ask will report a slight itching or burning sensation right after the treatment, which will disappear within 20 to 30 minutes. And again, after 3 to 4 days, when the skin comes off externally, they have the same sensations. I usually tell them to use topical cream on the outside, and we'll try to tell them that this will not be related to an infection usually, and if they're concerned, they should be coming back, because sometimes people tend to overdo the treatment then, and this can cause impact onto the treatment regimen. I will go quickly. The question is another treatment necessary at the same time for one infection, or is the laser just enough? If I get the question right, you asked me whether you should combine those treatments with other machines, probably, as it is done in several studies. I wouldn't do so, because you have a thermally or you have an energy-based device that brings heat into the skin, and I wouldn't do this. There are some studies that use CO2 lasers to sort of induce other medications into the skin, but there are very few results and very preliminary studies that show effects to this, and I think we will have to wait more and see further studies that shows that there's an efficacy to this procedure. I hope this answers. Yes, the laser is just enough, and if you get used to it, and if you alter the settings by your experience, you will get a very, very good result. I think it is possible to have this presentation. There was a question, and it will be spread out through Syneron Candela for the ones that have registered to it. I never had a patient developing a Candida infection after a treatment or due to the treatment. Of course, you can have this um, simultaneously, so by coincidence. But as we use the laser before using it for infections and to get rid of wound debris in a surgical setting, we know that it is rarely seen that there's any infection, especially with a candida. Of course, in the one of the prerequisites to do this treatment, you have to examine the patients and be sure that there's no vaginal infection before. And if the patient has discomfort or itching due to a Candida infection, of course, you have to postpone the treatment. I have had 3 patients with PRP treated that I now, after I have done it, have used the CO2RE Intima, especially for vulvodynia. This seems to be a very, very promising setup, but the studies that we have right now are very, very limited. So I think this still is on a probatory phase, and so every physician who does it should define it for himself. I personally think that the effect can be very, very good, especially as these patients do have a long history of pain and discomfort, and if they come out with a good treatment that you, in terms of vulvodynia, combine with other treatment methods like physiotherapy and as well as neurological counseling, it will help them definitely. And the results for PRP and CO2RE Intima are very promising, and I hope that we will have more studies that will have larger numbers of patients to show us these results. So we are almost done with question and answers. So if you have one more, I could be answering. There are 3 minutes left. To get all this together then, if you have no more questions, I would like to thank you very much for your attendance. I'm quite sure that CO2RE Intima will play a major role in your everyday gynecological practice in the future, as these technologies advance very, very quickly, and patients will have to ask for it, or will ask for it in the future. And we cannot deny this technology to our patients and to ourselves. It will help you, and you have a very, very steep learning curve adapting those systems into your office, and you will find more indications in your office if you start using the system and break down the internal barriers that keep you away from using it. I hope we will meet again on one or another conference and have a decent talk about your experiences. And I hope you enjoyed a little, and I'm sorry for the wasp that was getting into my room and trying to get me away from this talk. Have a nice evening, and thank you for listening.